Okay, we are live. Good morning, Facebook. Hello, early risers. I'm Andrea from SCAN.
Good morning, I'm Marybeth from SCAN, and welcome to SCAN FYI. Hope everyone is doing well and navigating the heat wave we're having. This morning, I'd like to welcome our special guest, Jim Winn from Comfort Keepers. Good morning, Jim.
Good morning, ladies.
Good morning, Jim.
So Jim is actually a board member of SCAN, correct? And
Yep.
Jim,
Been for 5-6 years, I think now.
A long time.
Yep.
Well, that calls for a coffee toast. Thank
Yeah,
you, Jim.
they haven't kicked me off yet. Cheers.
The day is young.
So Jim is the owner of Comfort Keepers, and Jim, I'm gonna leave it to you to tell us what Comfort Keepers is all about.
So we do in-home care, primarily for seniors and people that are homebound. We basically practice something called interactive caregiving, and our goal is to keep people safe in their homes. That's it in a nutshell. I have about 160 caregivers that do anything from a few hours a day, 2 hours a day, to 24-hour living care.
Okay. And you are located and
I have
cover.
an office in Shrewsbury and in Edison, but we cover all the way down to Brick and Lakewood up to Clark. So we pretty much go up the Parkway and down I-95.
All right, and just a reminder to everyone out there who's listening, after this segment is over, we will put all of Jim's contact info in the comments on Facebook, so you don't have to write anything down. You'll have no trouble reaching out to Jim. No trouble at all.
They can always just Google me.
So how has everything been for you? What has this COVID situation been like in the world of home care?
So, COVID is tricky, especially at first. It's constantly a moving target. In the beginning, just like everybody else, we kind of navigated towards, immediately I kind of went to, we're required to do nurses visits, and we did those remotely just to kind of lower our contact with our clients. Obviously, our clients are the most vulnerable of the population to COVID. So we put protocols in place where the caregivers actually take their temperatures every day. They report into us through our telephony system when they check into the homes and things like that. And so we're constantly kind of keeping in contact. So if anybody is to come in contact with anyone with COVID, we quarantine them for 14 days and we pay them. So if they have symptoms or anything like that, they don't go to work. If they come in contact with someone with COVID or they test positive, we quarantine them. And then on the other end of it, since some of our caregivers go home to home, anybody who comes out of a facility, we're requiring 24-hour test from when they are released. So the important part is we don't want my employees getting COVID either, and spreading it to their families or them getting sick also. So that being said, it seems to be currently that home care is a safer option. We've had no clients really. I've had one that came down with COVID and they got it from a family member, and my caregiver who had worked there had been immediately quarantined, and she subsequently never got it. And so out of all my hundreds of cases, we've been very, very lucky, in conjunction with what the statistics for the population are, we've done very well that way.
You have.
So not to say it can't happen, so I tell everybody who comes aboard, I say it's always a risk. Even if you were to test people every day, they could spread COVID. But for some reason, the amount of contact or being at home there has not been a huge spread of this. So.
Jim, did you have to try to manage the assignment of some of your home health aides to keep more control over the environments they were going into?
Yeah, so one big thing is if they are in a facility, they can't work privately in a home. So we separated anybody who works in a facility, because we do work in assisted livings.
Right.
They can't work in the home. So you know, that way we can,
More
that
control.
way we don't
Right,
have that.
you're
kind
having
of
some
contact.
control. Yeah.
Yeah.
And what about your, your staff? How did they feel about all this? Was there any reluctance on anyone's part, to go to someone's home?
Yeah, so we had some people who took themselves off the rolls. We had so we have older caregivers. We have people as old as 70 working for us. So some of those people really, and some continue to work, which was interesting, but some took themselves off, and which is okay, because they didn't want to go to home. And a couple of people who had families in the beginning, again, when people didn't really understand this, they stopped working. So there was a month or so. So for our clients too, it was, they're warned that there could be possible gaps in coverage just based on people being quarantined, and so forth. So,
Right.
and also if somebody leaves the state, we don't have them work for 14 days. So, and then my live-ins stayed in the homes. So we have about 30 live-ins, and most of them didn't want to leave anyway. So at that time, so I've had a lot of
Safer
them
to be in the home.
Yes.
Yeah.
Yeah. A lot of changes, I guess.
Yeah, I mean, a lot of changes, but I think one of the things is that, they realize that people realize that this is kind of a safe option. So sometimes people were foregoing going to rehabs and places like that and just going directly home because they felt it was, the one-on-one contact was a little bit safer than the facilities.
Jim,
What
why
kind
don't you,
oh.
go ahead, Andrea.
Well, what kind of things did the clients have to do within their own homes to keep the environment, I'll use the word safe, for the caregivers to come and go?
So we take their temperatures also. So,
You talk the clients or the caregiver?
Yeah, we take the clients' temperatures also. So
Okay.
it's a requirement that the clients get their temperature taken before every shift. We do COVID evals, things like that. We limit visits by family. Family comes, they have to wear a mask.
Okay.
Everybody has sanitizer, so all the surfaces are cleaned when they're there at the home. Any kind of close contact, client wears a mask, caregiver wears a mask. Sometimes the seniors are resistant to wearing masks because they're old school. They figure if they're going to get it, they're going to get it. But we do explain to them it's not really just for them.
Yeah, it goes both ways, right?
It goes both ways. So, and for the most part, people have been pretty compliant as far as that goes. So, so far it's worked. It's changing constantly. We're testing our caregivers more and more, but the tests, because everybody's getting tested, it's taking longer to get the tests back. So really the evaluations, limiting their contact with family members, the symptoms, trying not to get too close to clients, I think that's all worked.
I was going to say, Jim, why don't you share with some of the people who are watching exactly what some of the services are that Comfort Keepers provides? I mean, they run the gamut. I know my mom personally used your services a few years ago, so I think that would be great to share that.
Yeah, so we do everything from, it could be a companion care if somebody has dementia, that we come in and just kind of keep them active, play games, things like that. Then moving more towards personal care. They may need help, assistance with showering. There's some families that don't want to shower their parents. Maybe you might have a family member that takes care of somebody, but they don't want to shower their parents, and we may come in for just 2 hours to do some things like that. And then sometimes it's all day, so that family member can go to work, and make sure that their loved one is okay. So we do everything from incontinence care, personal care, and then we do private duty nursing. We do certain types of wound care, certain types of helping with colostomy bags, things like that. So
it really runs the gamut. I think a lot of people don't realize, I think a lot of people just think you send someone to your home and they kind of sit there with you as a companion. But obviously it's far more extensive than that.
Yep, I look at it as assisted living at home.
Okay,
you know.
that's good. That's a good way to put
Yeah,
it.
so we have some people that the family's not nearby or they can't do it, they're too busy, and we'll take them to the doctors. Sometimes they want one of our nurses to accompany them to the doctor, because a lot of times the seniors can't get the information correctly. So it's all done that way, and sorry about all the noise. So it's
live performance, anything can
a live
happen.
performance. So of course the landscapers showed up just in time, and they'll be gone as soon as after we're done the show.
Fine.
So we kind of do a total care. So assisted living, sometimes we make sure the house is in good shape, things like that. Big thing is we practice interactive caregiving. We want to keep the caregiver, we want to keep the caregiver engaging with the client. So they're not just butlers. A lot of people think that when somebody comes into their home, they're going to take their independence away. But actually, this is a way of keeping them independent.
Keeping your independence.
Yeah. So
I think it's the opposite. Yes.
It's the opposite. So a lot of seniors are very resistant to this, which is always, I laugh, because you and I would love to have a comfort keeper come to our house and do our laundry and change our sheet. Yeah, put it away,
I'm so ready.
All that stuff, help us cook, do the dishes afterwards.
You can have free reign in my house.
Exactly. And I kind of joke, I say it's like having a friend, but a friend that you can boss around, which is kind of the best kind of friend to have.
Oh, God.
So,
right.
So in that way, it's just a way of keeping them at home and safe and all that. So some people are more, and when I go and see people, some people are more appropriate for assisted living and facilities, and I'll tell them that. And some people are better off at home, and we can keep people at home till the day they die.
So will you go to someone's home to kind of do an assessment and actually determine whether or not they are appropriate for your services? Or, do they belong at home or not?
Yeah, so I'll go in and talk to people. I go and talk to them all the time, and they and basically I'll discuss our services, and basically I'll look at the home and all that. Sometimes the home's not appropriate for people to stay long term in. A lot of people have split levels, things like that.
Many stairs.
And sometimes their option is, if they're real social people, maybe over 50 or assisted living, or they're just better off at home. If their goals are to stay at home, sometimes the advice is maybe to move to a smaller home. It's very hard for seniors to move from their homes sometimes. They have a lot of memories there. But I see a lot of them move, and they're very happy they did, because they got rid of all that stuff. It's a smaller home. Things, aren't falling apart. So I'll go in, I'll do an assessment, I'll give an honest answer. There's a better option for them, I'll recommend it. Sometimes we'll talk about long-term planning, what their costs will be, over the long term. And some people go sign up with us right away, and some people, takes a little bit of time till they kind of make up their mind what they want to do. And there's people that start out with once or twice a week, and then they go to longer care, maybe full-time care, live-in, or something like that.
Well, it's a service that you can grow into.
Right.
You might start out with one day, and then, depending on what your needs are, you've got it all.
Yep.
Yeah.
And Jim, I would also like to add too, and when a family member is coming out of a rehab facility and they have to have a discharge plan in place, which was my situation, you came out, met with my parents, and we had a meeting there to discuss.
Yeah, so that's another circumstance. That's a temporary, in your circumstance, for your parents, it was a temporary situation. Sometimes it may be a month. It could be 2 weeks. Sometimes people start out with a live-in when they come out because they're concerned about whether they'll take care of themselves, and then maybe they'll go to hourly, and then sometimes they get better and they don't need us at all, and that's wonderful.
Right.
So, so there's a lot of different options for people, and then sometimes COVID, people are kind of skipping the rehab at times.
And just going home.
And just going home. But sometimes I recommend they might be better off at rehab. It just really it depends on that circumstance, So, more and more, I think it's safer to go to facilities, from what I've seen. So, yeah, every circumstance is very, very, very different, So
So
sometimes
Jim, people though, potential customers out there, you should all feel confident and comfortable about bringing someone into your home. Even though COVID is affecting everyone, obviously you're taking a lot of precautions, Jim, to make sure, safety on both sides, client and staff.
you can never guarantee 100%. I always tell people it could happen. It hasn't happened yet, knock on wood, but it's always a risk, but it seems to be a safer option. And one day I think we'll figure out why it seems to be so much safer that we've had people go into their homes and not spread it. I think the precautions that we've taken have helped a lot. And I also think maybe the contact is less closer than, say, in a facility. It might be not as many people. It's one-on-one.
Oh, for sure.
And so forth.
Yeah.
The quarantining helps, but it's painful for scheduling for us because once you take somebody off the schedule for 2 weeks, it's quite a bit of time.
A long time. And of course, who wouldn't rather be home, right? Given a choice of home or another facility, I think most people would rather be in their own home.
Yeah, most people. Depends on the home. So I've gone to some homes. I've seen some people that are happy, when they go to a rehab because the home is maybe a disaster. But most of the time, people want to be home and they're kind of better off there, and more comfortable. Particularly if they have dementia or Alzheimer's and things like that. Sometimes we see them get worse in facilities just because they're confused about where they are.
Yeah.
Studies that show all the beeping and the disruption of the sleep, can exacerbate it, and sometimes when they get home, they get better, they get less agitated and things like that. So, yeah, I mean, that's the goal.
There's no place like home.
There's no place like home. There really isn't. But, if people are going to stay home, they need, and this is a segue, they need things like SCAN to keep them socialized because the isolation is not a healthy thing. And I'm sure you hear the same thing. It's like smoking 10 packs of cigarettes a day.
Yeah.
People are isolated, I'm encouraging my clients to do these Zoom meetings and the classes online and get some of that socialization. We've had technology that we've worked with, and I'm still continuing. We have a grandpad that we put in people's home that they can talk to family. The technology's changed. It's evolving. More and more seniors can use Zoom. I'm seeing them in their 80s and 90s, and they're getting on Zoom now, and they're loving it. And
of course, we see that at SCAN now, right, Marybeth? We see that, which is great. All right, well, Jim, I want to say thank you very much for being our guest today. Jim Winn of Comfort Keepers.
Thank you for having me. It's great to see you guys. Again, great show, and your mission is just awesome.
Thank you.
You guys have done a really good job during this, adjusting to the changes. So,
well, we're a work in progress like everyone else, right?
And I also want to say that anybody out there can donate to SCAN. I'm going to do your job for you.
Thank you.
It can be a small donation, large donation. They do tremendous things for the community. If you don't want to call them and ask what they do, call me and ask what they do. You can give a small donation, large donation. So I'm going to give you guys a plug in that way. So,
well, if it's multiple choice, we'd rather have the large.
Large donations are good too. They'll take as large as you want to give, but
Thank
small
you,
helps
Jim.
also.
Yes, thanks, Jim. Have a great day.
Thank you.
All right, cheers.
Thank you.
Okay, remember, if it's important to you, it's important to us. I'm Andrea Tarr, and we will see you next time. That's next Wednesday on SCAN FYI. Bye, everyone.
Great day.